so just now we talked on how is it synthesized. Okay, so the take-home message that you must remember is the process. Okay, make sure you understand how is it being synthesized. Okay, and compare it with oxidation. What is the difference between how is it synthesis differ from beta oxidation? Okay, it could be the enzyme, it could be the uh, basically you have to understand the process lah. Okay, to understand the process, you must know the enzymes involved as well. Okay, so that is regarding how fatty acids are being synthesized in cells. Okay, so once it is synthesized, how is it being modified into, let's say, different phospholipids? Okay, so for the next part, actually, for this learning unit 3, we are going to look at some of the synthesis of glycolipids, okay? Mainly your diglycerolipids, okay, or your triglycerolipids. Okay, and also look at the liposomides, okay, which is one of the lipid component, okay, that is present in a cell and produced at a specific location only when it is needed. Okay, and also, of course, cholesterol. Okay, so it's all basically starting from the fatty acid. Okay, so now you have the fatty acid. Okay, you know fatty acids, you need when to convert your fatty acids into glycerol, triglycerol, okay, or also known as glycerol. Okay, glycerol plus lipid, which is glycerol plus fatty acid. You basically have your glycerol molecule and also three fatty acids. Okay, so glycerol-lipid biosynthesis. Now, as you can see from here, you basically start with a glycerol. Okay, this is your glycerol, okay, with 3 carbon. So what happens at the end is that for your glycerol-lipid biosynthesis, the starting precursor, okay, take note that, take note, the starting precursor that is important for the synthesis to start will be to form this precursor, which is phosphatidic acid, okay, which is this one. Okay, phosphatidic acid. So basically, as you can see, what happens is, like all synthesis process, you need to invest energy. Okay, ATP is being used. Okay, basically causing phosphorylation of this glycerol here. Okay, forming glycerol 3-phosphate. Okay, so the next 2 steps here basically involve the addition of fatty acids into the remaining 2 carbon. As you can see here, now, here you can either add fatty acid with a CoA or a fatty acid with an ACP. Okay, either one is okay. So basically, one is being added, and then the next steps, same process, the second fatty acid is being added, therefore giving you the phosphatidic acid. This is the precursor or the starting material that is needed for the following conversion. Conversion into what? Conversion into either diacylglycerol, DAG, or your CDP DAG. So basically, this is your phosphatidic acid. As you can see, 2 fatty acid and 1 phosphate group. Okay, so it can be either converted into your CDP DAG, various different kind of it's a complicated process whereby it forms this complicated structure. Okay, this is one of the things that it produce, or it could be forming other diacylglycerol. Okay, so as you can see here, so if it's formed by acylglycerol, basically your phosphate group here is being removed and being changed to a different groups or structure. Okay, basically your CH2OH. Okay, so this is your diacylglycerol, which can then be further converted into many different kind of product. So basically the precursor or the main starting material is this. Okay, this is the starting material before various kind of modification is being done to this structure. That maybe you see, as you can see from this one, many different kind of structure are being added. Okay, it could be a benzene ring, it could be what a different complex phenolic group, okay, to give rise to various kind of compound or structure. Okay, so basically, the most important thing, the starting member is your phosphatidic acid. Okay, so it's like the crossroad lah. So tak kira you nak produce whatever kind of lipid containing glycerolipid, the starting material needs to be this. Okay, so first of all, confirm now these steps, only then you end up getting your phosphatidic acid. And this phosphatidic acid will be the basic ingredient that can be further molded into perovskite of glycerolipid. Okay, so basically that is for glycerolipid. Then apart from glycerolipid, another component will be your eicosanoids. Okay, eicosanoids are important regulatory molecules. Okay, consisting also of long fatty acids. Okay, so now from the previous lecture, we have synthesized fatty acids, right? We have a long chain of fatty acids. So what do you do with that? So that fatty acids can be added with glycerol to form a glycerolipid. It can also be modified instead of binding with glycerol. It can also bind with other things, okay, to produce different kind of molecules, including eicosanoids, which are normally involved in regulatory processes. Okay, so there are basically two different classes of eicosanoid. Okay, mainly you have prostaglandin and thromboxane, okay, which are from the same class. And second class you have leukotriene. Okay, so prostaglandin and also thromboxanes are normally those that are produced when you have certain injury, for example. Okay, when cases whereby someone accidentally scratch, let's say accidentally, okay, example paling senang, suddenly fell down lah, tiba-tiba terjatuh, okay, and then the knee, okay, the knee is suddenly scratch on the some rocks lah, okay, some rocks and then bleeding lah on the knee. Okay, so the bleeding only take place at the knee. Okay, so it is a localized an injury whereby it only bleeding only occur at the knee. So these regulatory molecules, which are normally involved in a blood clotting process and pain sensation, for example, these are immediately produced at the bleeding location. So these are very much local regulators and function where they are produced. So if the bleeding occurs at the knee, so normally this will be produced near the knee, okay, which is why we give rise to the pain, the feeling of pain at the knee, okay. So because only the knee is injured, so these molecules are produced, therefore causing pain feeling only at the knee, okay. And also clotting factors are attracted and produced and formed only at the knee, okay, localized, not causing like the blood clotting towards the body and so on, okay. So it's very specific and created in places where they are needed only. Okay, so these are normally those that gives rise, for example, your prostaglandin. Okay, so it gives rise to the feeling of somewhat like a pain, pain feeling when certain places are injured. Okay, and it also causes inflammation. Okay, which is why the injured place turns red. Okay, and feel hot like that because your white blood cells and everything, your immune system will start to do its work. Okay, and of course, and also causing swelling. Okay, so they are all localized, specific location only, and thromboxane, okay, in blood clotting and constriction of arteries. Okay, so because it is bleeding, so you want to cause the arteries, okay, the vein, okay, the blood vessels to constrict so that it becomes tighter, okay, smaller in diameter, so that in a way it helps to reduce blood loss lah. Okay, and also we have leukotriene. Okay, leukotriene is a different class. Okay, so it's normally involved in allergic reaction. Okay, if someone that is allergic to something, if someone suddenly became uh, starts to sneeze and so on, so these are response triggered by leukotriene. Okay, like for example, asthma and arthritis. Okay, these are inflammatory responses that are triggered by the body itself. Okay, so these are the structures. Okay, as you can see, the long fatty acid chain. Okay, so these two classes, okay, are produced by a different pathway. Okay, for prostaglandin and thromboxane, okay, so prostaglandin and thromboxane, they are synthesized via this glycooxygenase pathway, whereas for leukotriene, okay, there's a slight typo, okay, this is synthesized via this lipoxygenase pathway. So we are not going to go into detail, okay, how does the pathway looks like. Okay, so basically, as you can see this one, okay, no matter which pathway that we took, the starting material, okay, the starting material for eicosanoids, because all these are eicosanoids, right? So starting material, okay, that is used to synthesize those different kind of eicosanoids will be basically your arachidonic acid. Okay, so these arachidonic acids basically taken, okay, from the membrane. Okay, arachidonic acid and membrane lipids are released for eicosanoid synthesis in the cell interior by this enzyme, okay, phospholipase A2. Okay, so from phospholipid, it is basically gonna be converted into taken from the membrane. Okay, it's gonna be converted into the arachidonic acid, or it can also, instead of just from this phospholipid, it can be also from your diacylglycerol. Okay, your diacylglycerol, this one. Okay, it can be also from this. Okay, so once you have this produced, and then if you have this produced as a product, so this can also be used further for production of arachidonic acid, which can be used further for production of your eicosanoids, okay, including this one. Okay, so we are not going to look into the specific pathway because there's a different complicated pathway as well. Okay, so just bear in mind that leukotriene is produced via lipoxygenase pathway, okay, whereas prostaglandin and thromboxanes are produced via cyclooxygenase pathway. You can read up some details on this. We are most encouraged to read some more details on this, okay? But you'll find that there's a different pathway lah. And when you look up information, you'll notice that cyclooxygenase pathway here is basically involving two different kind of enzyme. Okay, so namely you have cyclooxygenase 1 and cyclooxygenase 2. Okay, so cyclooxygenase, despite that, in addition to what they did, in addition to helping or catalyzing the process in synthesizing your eicosanoids, they are also taking part in doing different things. For example, you have your cyclooxygenase 1, which is important in controlling or regulating leucine secretion in the stomach. So it's basically a layer that helps to protect the intestine. Okay, so this fella here is the one that is responsible in controlling the amount of, it's like the sticky layer that helps to protect the stomach. Whereas you have COX2, cyclooxygenase 2, which is very similar to this, okay, which is the isozyme or isoenzyme isomers, where these two are very similar in structure, but they still take part in doing different things. Okay, so this one helps to control the mucin secretion, whereas this one helps to promote pain and inflammation and fever. Okay, it's basically involved in inflammation process. Okay, when you have some a certain part that is inflamed, it could be the whole body that's inflamed, or certain localized places that are inflamed. Normally, you have increase in temperature. Okay, it's whole body, then basically it's a fever reaction. Okay, so normally people do not like this feeling, right? But inflammation, lebam lah, kemerahan, is bruises and so on. So these are all inflammation response, okay, including fever and so on. So people will resort to taking pills, okay, like medication. Like one of the commonly taken pill will be aspirin, for example. Okay, when people have a certain inflammation, fever, ataupun certain soreness or certain painness from certain, let's say, uh, certain places that are very, very painful. Like when you go to see the doctor, then maybe the doctor, or you go, or sometimes some of you go to buy some painkiller, lah, for example, aspirin, for example. So sometimes for some people, when they take aspirin, they will have this uh, discomfort. Okay? This painkiller here, basically the purpose is because, as you see, the feeling of being inflamed, okay, sakit lah, fever lah, all these things, these are symptoms triggered from the inflammation reaction that is activated by this COX. Okay, this is kind of like the main culprit lah. So painkiller actually helps to stop this, but okay, there's a but. Okay, this fella here, aspirin or even diclofenac or even your constant, they are not specific COX inhibitor. Okay, so sometimes when people take painkiller, okay, the purpose is to stop the pain and reduce the fever and so on. Okay, but it also have some side effect due to the non-specificity of this COX inhibitor. Okay, this is not specific, whereby the purpose actually, you take the pill, you want to stop this. Actually, you want to stop this, you don't want the pain, you don't want the fever and so on, you don't want the inflammation. But because these two are very much alike, okay, this fella here don't know, it's somewhat like dia tak kenal ini Ali ke ini Abu ke. Okay, so it cannot differentiate, which is why it is non-specific. So in addition to acting on this, okay, of course, when you take painkiller, it helps you to reduce the pain. But at the same time, some people will have some stomach discomfort, okay, feeling macam cerit-berit lah and so on. So this is because some of this, okay, will actually stop the action of this as well. Okay, so this fella here is basically helping to produce a kind of like a protective layer on your stomach and intestine. It's like protecting. Okay, so when you have painkiller, uh, with the aim of stopping this, okay, stopping this, but you also, because this fella here do not know how to differentiate between these two, so basically it will stop both. Okay, you stop the pain, but at the same time you also stop the protection. Okay, so which is why without this protection, if let's say someone eats something, then sometimes after taking this, they will have some stomach discomfort lah. Okay, causes stomach upset and other side effects which are normally related with your gastrointestinal system. Okay, so this is mainly because of the non-specificity of this COX inhibitor, which is your aspirin, your diclofenac, constant, and this kind of painkiller, whereby in medical terms they will just say, oh, ini kesan sampingan. Kesan sampingan daripada makan painkiller. Okay, because we have uh, because this fellow here actually inhibited those, but most likely the doctors won't tell you that it's because this painkiller actually stopped this as well. Okay, they'll just most likely just mention that this is the side effect, okay, of taking a painkiller. Okay, so the reason is because of this painkiller here. Okay, so the structure, this is basically your aspirin lah. Okay, the full name is acetyl salicylate. Okay, so it is basically this fellow here. Okay, this is your COX. Okay, COX, cyclooxygenase enzyme. Okay, so this is the one that you see here. You imagine this to be the important active site inside the cell. Okay, because sorry, not inside the cell, inside the enzyme. Okay, enzyme. All enzyme has their own specific site. So what we are looking at here now is basically the active site. What is actually happening inside. So this fellow here, when you take, okay, so one part of this, the one in red, is basically the one that is going to be stuck and bind with your COX. Okay, so because of this binding is going to cause this enzyme, okay, your COX here, to be inactive. Okay, so bye bye to this. So If it's bye-bye to this, then it's okay because that is the intended point because you want to stop the pain, you want to stop the inflammation, you want to stop the fever. But unintentionally taking that will also causes this to be somewhat like a stop, sure. So you lose the protective layer. So some of you might have stomach pain. But with the advancement of technology, new drugs are being developed, okay, which are more specific, okay, such as your Vioxx and Celebrex, okay, specifically inhibit COX2. Okay, so this kind of painkiller is good, whereby they are specific. So which is why then the doctor will say, oh, we have a new drug. This is improved version. You don't have side effect taking from this. Okay, the reason behind it is because this is very specific. So it won't go and disturb this. Okay, so if this is not disturbed, aiming specifically only this, then of course no side effect. Okay, so that is regarding cyclooxygenates. Okay, so which is on your eicosanoids. Okay, if you're interested, do read up more on this COX1 and COX2. Okay, so make sure you understand how is it taking part inside the regulation pathway. Okay. Okay, now the third component, cholesterol. Okay, so cholesterol, as you are aware, they are also synthesized from your uh, from it's kind of like starting slight difference lah, in a way, whereby as compared to phospholipids just now, basically once you have the fatty acid, you join it to glycerol, and you have your phospholipid various kind, different modification. But starting from your fatty acids, right? Mainly starting from your phosphatidic acid, these are starting precursor. Okay. For cholesterol, on the other hand, it is slightly different. Okay, whereby this is your cholesterol. Okay, as you can see, the structure is very much different. Okay, so instead of starting um, to fold, you have a long fatty acid chain, right? So this structure that you see here is not produced from the folding. Okay, dia bukan you have the fatty acid and then you fold it into a complex structure like this. No, it basically starts from two carbon. Okay, so there's a series of steps. Okay, it's actually much complex than what you see here. Okay, so which is why we are not going to go into every step of it. Okay, so this one that you see here is basically just an overview. Okay, an overview of what is actually happening. Yeah. Okay, so basically it starts from a two carbon. Okay, your acetate. Here we have this picture there. Okay, so now the first step here is basically starting from your acetyl CoA. Okay, so the step one, okay, is basically, okay, you still remember your fatty acid synthesis, your raw material is basically your acetyl CoA. Okay, so seeing acetyl CoA is being used as the starting material. Okay, it's being converted into isopentanyl diphosphate. Okay, so the first step in cholesterol synthesis is sequential condensation of three molecules of acetyl CoA. So this is a product that you see form from the condensation of two acetyl CoA, because you have four carbon already here. Okay, one, two, three, four carbon. So it's basically here, it's basically three acetyl CoA that comes together stepwise. Okay, two comes together first, and then it forms this, then it forms this. Then a third member comes in. Okay, okay, and then with the help of this HMG-CoA synthase, okay, it helps to convert this into a six carbon member, okay, which is abbreviated as HMG-CoA. Okay, HMG, this is the full name. So take note, this is the enzyme responsible to convert this into a six carbon member, which is your HMG-CoA. So this one here is the one, okay, the product of the product produced, which is this one, is then reduced to mevalonate in a reaction catalyzed by HMG-CoA reductase, okay, which there will be an enzyme that is involved. Okay, as you can see here, this from first two carbon, the steps that you are going to see is basically starting from two carbon, which is your acetyl CoA, will lead to the generation of a five carbon. okay, which is an isoprene. Then from this 5 carbon, you will have more of this structure coming in and eventually forming this. From 5, you will see later, it will go to 15. Okay, from 15, two of these 15 molecules is going to come together and give rise to your 30. And with some modification, which involves a lot of different complicated steps in between, eventually it gives rise to a cholesterol of C27. Okay, so now from here, now you end up getting to this. Now this is your mevalonate. Okay, you have 1, 2, 3, 4, 5, 6. 6 carbon. Okay, 6 carbon coming from 3 different acetyl-CoA. Okay, so the conversion into from your HMG-CoA converted into your mevalonate is catalyzed by this reductase enzyme, and this takes place inside the cytoplasm. Okay, so if this structure here happens to end up going into the mitochondria, then it's basically going to be converted back into acetyl-CoA. So synthesis takes place inside the cytoplasm. Okay, you have where you generate the mevalonate. Okay, so take note, this actually is the important enzyme reductase here that helps to determine, okay, produce cholesterol but not produce cholesterol. Okay, so this is the important regulating member, okay, that directs to the production of mevalonate. And once you have that mevalonate, so this is basically another picture, okay, to illustrate the whole process again. So you have two, okay, comes together to form your 4 carbon member, and then the third member comes in, so 4 plus 2 will form the final HMG-CoA, which further with the help of reductase some more back in the cytosol, you end up getting your mevalonate. And this mevalonate here is going to be converted with a series of another few more steps, okay, eventually losing off 1 carbon. Okay, don't forget, the main purpose is to generate your isoprene. Okay, so isopentenyl diphosphate, which is a 5-member carbon. Okay, this one. Okay, to this one. Okay, from C2 to C5. Okay, the C5 is isoprene, which is your this one. Okay, so once you have this, then you move to the next stage. Okay, okay, I'll go to the picture. Okay, so this is your isoprene. Okay, which is a 5-member one. So firstly, the enzymes that is gonna be involved in the process is basically an isomerase. Okay, to convert it's basically to suit the need lah. Okay, so because the double bond is not in the proper place. Okay, so to change or to switch the double bond to from here to here. Okay, then you end up getting this structure here, and eventually this structure here is gonna come together. Okay, so with removing 2-phosphate group. Okay, so this one is 1-dimethyl allyl diphosphate, 5 carbon. Okay, then the same thing is going to happen with another. Okay, so this two, with the help of this transferase enzyme, you imagine this two lah. Okay, 1 and then 2 is basically the same thing. It's going to come together. Okay, C5 and C5. Okay, 2 is going to come together. Okay, produce this 10 first. Okay, because this is 5 and then this is 5. Comes together to produce this 10. Okay, this is kind of small. Okay, so hopefully this is larger on your view as well. Okay, so you have this. Let me just grab this out. Oops, oops, oops. Okay, hopefully this is clearer on your end as well. Okay, so you see from 5 carbon, okay, another 5 carbon, the same process takes place. 2 of this, okay, combine together, you have this C10. Okay, they basically combine together with the help of this transferase. Okay, then you end up generating this, okay, from this, and then another third member, okay, something like this one, the same thing. Another, the third one comes in, so 10 plus 5, you end up generating 15. Okay, so 15. So you have to look at this one first, okay, because what it means here is the 15 generated, you basically combine with another 15, which is why you end up generating 30. Okay, so this goes to this, like, once you have this, you imagine there's another one that combines. And then once you have this, you imagine another copy of this combined with this. So it's basically a stacking up of the product. Okay, so when you have this converted to this, then 3 copy of this gives rise to your 15. Okay, then this 15 here combined with another 15, then you end up generating your squalene, which is your C30. Okay, which gives rise to this one. Okay, it's basically 5 plus 5 plus 5, 15, and then 15 plus 15, you end up getting 30. And then this 30 here is going to go through a series of transformation. Okay, okay, so the process is like this. Okay, so you won't see the detail, plus it's very complicated. Okay, so basically your squalene, okay, once it is produced, it has this kind of a structure. Okay, it's not closed yet because as you recall from cholesterol, you basically have four ring, right? In cholesterol, you have 4 rings like this. So the next final steps is basically to form that ring structure. Okay, so it involves various kind of enzymes in the process, and it's very complicated. From squalene to end up generating your cholesterol, it involves more than 20 steps. Okay, plus all this in front. Okay, so it is basically aimed to cyclicize, jadikan dia circle, okay, to make it into circle form, okay, via the help of various kind of enzyme. Okay, we are not going to go into uh, the detail of every step. Yeah. Okay, so this one is just for you to know, okay, to understand as well. So this is how cholesterols are made. Okay, so then we have the cholesterol. Okay, final cholesterol steps. Okay, so the main control, okay, so of the steps will be your HMG-CoA reductase. Okay, so this is the member, which is this one. Okay, nak tak nak hasilkan cholesterol is determined by this, is kind of like controlled by this fellow lah. Okay, it's likewise for your fatty acid synthesis, it's very much regulated by your ACC. Okay, so for cholesterol, it is this fellow here. Okay, it's the rate limiting steps in cholesterol synthesis. So normally rate limiting steps is normally the steps that are kind of like slow. Yeah, slow, so it's much easier to control. Okay, so normally when we come to enzymology, right? So normally the rate limiting steps are the one that is normally being regulated. Okay, because how fast or slow that process goes is determined by this process itself. So by controlling the rate limiting step of a process, so you basically control the whole process. Okay, as the rate limiting steps, it is the principal site of regulation in cholesterol synthesis. Okay, so which is why this is the enzymes that are normally regulated. A number of drugs called statins are potent competitive inhibitors of this enzyme reductase. Okay, so statins are often for hypercholesterolemia because meaning to say high blood cholesterol. Okay, because they can effectively lower blood cholesterol levels. Okay, this drugs, okay, this medication. Okay, another useful approach is to bind bile salts to prevent their reabsorption. Okay, so cholesterol, okay, your bile salt is actually synthesized in containing from it's actually modified from cholesterol as well. So which is why bile salts is actually uh, part of your cholesterol. Okay, so uh, because things, as you are aware, as you have seen in synthesis as compared to breaking down. Breaking down, normally you break down, you generate energy. Okay? The purpose of breaking down is so that you end up generating ATP. But when you synthesize at a cost of utilizing energy because you want to make something new. So which is why synthesis process normally involve the investment of ATP. So in animal, whenever things that can be reused, they will normally not break down straight away. So likewise for biosalts, they can be reabsorbed. Okay, so if they are reabsorbed, normally then will lead to the, if they are not used, okay, so they will lead to an increase in a cholesterol level. Okay, uh, for the drug, for example, this statin, yeah, so this is kind of like a medication that is prescribed to help people to control blood cholesterol level, okay, especially for those who are overweight, normally obese people, which is why when you see people who are like with high blood pressure and so on, normally, or fat in a way, whereby normally they are automatically correlated with high cholesterol. Okay, as you have seen here, your cholesterol is made from fat. Okay, cholesterol are made from your starting material, which is for here. Okay, so it's basically you put up all together. As you can see how big is carbon 27. Okay, so buildup of cholesterol is actually linked with high blood cholesterol as well, which is a high risk for heart attack and so on. Okay, so buildup of fats and so on inside arteries. So to help reduce blood cholesterol, one of the drugs prescribed for normally high cholesterol patients is statin. Okay, so this will actually help to reduce the amount of blood cholesterol by controlling this enzyme here. Okay, so because this enzyme here, if you, because this is the member that is like the gut lah, the gut that allows whether fatty acid synthesis, cholesterol synthesis, sorry, cholesterol synthesis jalan ke tidak. Okay, so this is the guard that says so. Okay, so if you take this drug for cholesterol patient, uh, high cholesterol patient. So this drug is basically inhibiting this. Okay, so if it inhibit this, the reason why it can help to lower blood cholesterol, because if you inhibit this, basically you stop cholesterol synthesis. If you stop cholesterol synthesis, basically your cholesterol reduces, but it is not good in a way whereby in your cholesterol synthesis process, you also generate mevalonate. Mevalonate is not only needed for cholesterol synthesis, it is also needed for the synthesis of other molecules, such as your ubiquinone. Okay, so if taking this in an uncontrolled fashion or manner, you'll lead, although in a way that it will help to reduce blood cholesterol, okay, blood cholesterol level, because it basically stopped the synthesis process. Yeah, but at the same time, it also, for long-term taking, it's not good because it also stops the production of mevalonate, which is needed for other things. Okay, so it depends on the need, which is why for those who are with high blood and high cholesterol level, normally you have that there are several kind of drugs or a combination that can be chosen depending on the condition and advice from the doctors lah. Okay, so that is basically on cholesterol. Okay, so the take-home advice okay, for you basically from this whole lecture 2 weeks, okay, from on fatty acid regarding on liquid lah. Okay, regarding on liquid is that okay, make sure you know clearly the difference between beta oxidation and also fatty acid synthesis. So how are they broken down and how are they synthesized? Where are they produced? What are the enzymes involved? Okay, the process itself. Okay, make sure you know the process at tips of your fingertips. Okay, and then in regards with this different kind of fatty acids, what are the kind of like the, for example, the precursor that are normally used for fatty acids for various kind of fatty acids, phospholipid synthesis or eicosanoid synthesis? What is the starting material, for example? Okay, what are the enzymes that are normally controlled? Okay, in a certain synthesis process, what are they controlled, and so on. Okay, and then also on your like for oxygenase and also your cyclooxygenase. Okay, okay, so understand, okay, this part. Okay, make sure you understand this. Okay, and then cholesterol pathway no need lah. Okay, cholesterol pathway, I mean, we don't have to go and dig up the detail, how is it convert to carbon 24, no need. Okay, because we are not looking into the detail, how is it this one. We're not looking into the detail specific, how is it, but just for your information, you just need to know that at least this process involved the conversion of this with carbon. You can name a few of the enzymes, it's also good, but do know that the importance of this enzyme here. Okay, so this is how cholesterol synthesis is being controlled. Okay, what is the function of this enzyme and so on. Okay, yeah, this HMGA. So what is the role or played by this? Okay, then the place. Okay, the place where this process actually took place is in the cytosol, is in the matrix of the mitochondria. Okay, and then anything else. Okay, so the most important thing is your beta oxidation process, and also how is it produced, how is it broken down, and how is it synthesized. Okay, that part. Okay, so that would be all. Okay, from our 2 weeks of lecture on fatty acids. Okay, and then so far, any questions? Because from our schedule, okay, this is okay, next week you will be having your mid-semester exam. So it is gonna be via ELIP exam. Okay, multiple choice questions, 60 questions for a period of 2 hours, covering learning unit 1 and learning unit 2 and 3. Okay, so the part that has been covered by the committee and also the parts that we have covered together, okay, on photosynthesis and also your information on facts. Okay, and for photosynthesis, make sure you know the process. Okay, the how is it uh, what are the enzymes are involved in the regulation of the process, not to say regulation, the pathway, like the flow. Okay, the flow, and then you have your, okay, make sure you also know how to differentiate the C3, C4, okay, C3, C4 and CAN plant. What are the main difference between those three? Okay, so take note on that. Okay, medication regarding on this. Do take note on a few lah. Okay, just uh, remember a few of some of the drugs, okay, that are used to treat or to control. Okay, for those with certain condition, for example, for diabetic patient, because normally questions can be informed whereby you are given a problem. Okay, in a problem whereby, let's say you have certain patient who are having, let's say, diabetes. Okay, so you must know diabetic patient normally have problem with insulin. So if they have problem with insulin, so these are not mentioned to you in question, for example. So do take note on some of the medical condition that are related with the topic that we have covered. Okay, so you have uh, for our part, you have one of the things includes like this one ketoacidosis. Okay, the accumulation of ketone body. Okay, so so what leads to that, and what symptoms does it cause, and what kind of uh, side effect treatment and so on. Okay, so it's kind of like it you need to understand the biochemical process that leads to those kind of symptoms or disease. Okay, so which includes your COX just now, COX1 and COX2 and so on. Okay, so that would be all. Okay, so after next week, straight away exam will be an elite exam, and then the following week, after your mid semester exam, you will be meeting with Prof. Awang. Okay, so your next lecture, the next part of your lecture is gonna be after your mid semester, the following 3 weeks, if I remember correctly, the following 3 weeks is gonna be with Prof. Awang. Okay, and before we finish the semester again, the fourth lecture is gonna be by me and Prof. Awang again. So you'll be seeing me again. Okay, me after Prof. Awang, and then it's like we shared the lecture topic. Okay, so then final part, you will meet Dr. Mickey again. Okay, just before your final. Okay, so I think that would be all. Okay, so any questions so far? I do not check on chat. Okay, okay, Fazrul Nizam, okay,